All right, people, it's late at night and I don't get paid overtime, so you're not gonna ask me any of your silly questions. You're gonna ask your teacher. I'm just gonna take you through this lab manual real quick, which you can find in your lab guides content module. So what I was thinking is that since we have all these lovely posters on the board now, and volunteers and stuff, maybe I'd just take you through each bone on each thing, because it's all fair game. Okay, so the axial skeleton, the appendicular skeleton, articulations and body movements. Sound like things you've been learning about? Yeah. I'm not going to read you this first page. You have eyeballs, you can print it, you can read it. What we're going to look at is all of the stuff you have to be able to identify on that bad boy, or that bad boy, or some bad girl, or some bad model, or some bad they. Sutures, bones. Okay, so let's come back to the skull. No, let's not do it. See, can we see any sutures up here? So look here, we need to be able to identify which sutures: coronal, sagittal, lambdoid, and squamous. Coronal. Yeah, that was Kelly's leg. That's the coronal suture. That's the sagittal suture. That's the squamous suture. Whoa. Your head is falling apart, Kelly. That's the lambdoid suture back there. Oh, Kelly is only as listen to only as not. Coronal, sagittal, squamous, lambdoid, sutural bone. All right. Okay, so then what do you have to identify? Frontal bone. Okay, yep. Parietal bones. Occipital bone. On the occipital bone, you have to memorize some markings. The occipital condyles are these rounded things right here. Not rounded, but they're smooth. Those are the articulating surfaces that articulate with what? C1, the atlas. And when the condyles rock on those superior articular facets, you get flexion, extension, and hyperextension of the head. Okay, so occipital condyles. This big old hole is a big old hole. Foramen hole. Magnum, big hole. Foramen magnum. That's what you have to know on your occipital bone. Temporal bone. You have to know mandibular fossa. Okay, a fossa is a depression, and luckily our mandible's not in it right now. The mandibular fossa is that dip right there. So how the mandible should be is like that. So the mandibular fossa is that dip in the temporal bone that's holding the mandible. Okay, what else do you need to know? Squamous part, that's the flat part by the squamous suture. Tympanic part, the auditory part maybe. Tympanic is on the inside too. It's the outside of the tympanic part. What else? Petrous part. Wah, wah, right there. External acoustic meatus, right there. Zygomatic process, right there. Mastoid process, right there. Openings, carotid canal, jugular foramen. Okay, those we can only see from down here. Hang on. I'm just to get that mandible out of the way. So the thing about veins and arteries is that arteries are under blood pressure, so they tend to be deeper. And so yeah, veins are more superficial, and so if you cut a blood vessel and you've got like slow flow, it's coming out of a vein. If you've got really fast flow, it's coming out of an artery. So this is asking for the temporal bone, what's it asking for? The carotid canal, the jugular foramen is what we're going to see down here. So, can we see it? Yeah. So the, it's not super awesome. Carotid canal, right here. Jugular foramen, right there. So do you see how that's still the temporal bone? And now if we're looking from this view, we can still see our mastoid process and our petrous part. We can still see our zygomatic process. And now we can see the carotid canal. Woo! You can't see it if I'm so far in. Carotid canal and jugular foramen. Okay? Okay. So now if we look inside the skull, you can see it a little better. Our carotid canal and jugular foramen. And this is the, actually carotid canal is not coming all the way through. Sometimes models leave a lot to be desired. Sometimes lab assistants leave a lot to be desired. I don't know what to say. Okay, so inside here we've got our internal acoustic meatus, another part of the tympanic part. So your inner ear, your middle ear, all those cool ear structures being protected by the bone right there. Pretty amazing. What else? Sphenoid bone, greater wings, lesser wings, sella turcica. Do not tell your instructor that's a Turkish saddle. That's a sella turcica, and that's what it is. Even if sella turcica means Turkish saddle, that's not what we're going to say it is. Superior orbital fissures and optic canals you can see from back here, but they're also kind of cool to see from the front. Optic nerves go through these little optic canals. Ooh. Ooh, superior orbital fissures. Fissures are like slits through whole bones. Those are slits. They're superior. Canals are like round passageways through bones. That's what we see there. So we can also see these from the anterior view. Oh, look there. That's a superior orbital fissure. Ooh. Wow. Oh, optic canal. Ba-dang, dang. Whoa. Awesome. Ethmoid bone. Cribiform plate. Right there, moth-eaten. See all those holes? You can see them. Okay, cristogali. The thing sticking up. Coxcomb. You got that too. Perpendicular plate is right there. And it is making the nasal septum with the vomer, which is right there. Oh, look at our middle and inferior concha. You can see right there. All right, now people, we're on to the facial bones. Maxilla. And look, these little sockets are called alveoli. So the little things poking down are alveolar processes. So your teeth plug into alveoli. I need a jaw with a hole. Hang on. I have a jaw with a hole, but I have a maxilla with a hole. So those are what we call alveoli, the sockets. And then these little things in between that your gums like sit up on are the alveolar processes. So the hole is an alveolus. So your teeth plug into dental alveoli, and then those little up things in your mandible and down things in your maxilla are alveolar processes. And the other thing that your lab manual says is that your maxilla forms part of your hard palate. So there's the palatine process of your maxillary bones, and those are the palatine bones, and all of it makes your hard palate. All right, so you'll see when you swallow, you push food along your hard palate to make it swallowable. When it hits your soft palate, you start swallowing. Inferior orbital fissures. Oh, wah, wah, right there. Right there. What else? Zygomatic bones. Right there. Right there. Nasal bones. Ba-dang dang. Ba-dang dang. Look, there's the maxilla sticking up in front of my lacrimal bones. And I think in your lacrimal bones, yeah, you have to know that that opening there is your lacrimal fossa. So what makes up your nose? Lacrimal bones, maxillary bones, nasal bones, and a whole bunch of cartilage there in the front. Okay? I don't know, maybe your lacrimal bones don't make up your nose. I could be making stuff up. It's okay, I'm allowed to. I'm the assistant. That's not true, I'm gonna get fired. Palatine bones, we already met those as part of the hard palate. Ba-dang dang. What else? Mandible, vomer, inferior nasal concha. Inferior nasal concha down there. Inferior, middle, superior's up in there. Why? Because it's bringing in our olfactory epithelium. Well, that's, yeah, only partly true. And again, I'm the assistant. I didn't really learn about that stuff. The vomer. You can't really see the vomer very well, other than knowing it's right there, making up the inferior part of your nasal septum. What's the superior part? Perpendicular plate of your ethmoid bone. Okay. Mandible. What else do we... That's our last facial bone, I think. Here's our mandible. And mental foramen. Just in case you were wondering, I don't think you need to know that. Dental alveoli. We already talked about those. And the condylar process. So these are the mandibular condyles. And they plug into, they're the condylar processes of the mandibles. And they plug into the mandibular fossa of the temporal bones. Like so. This has been your skull. Alright, so what can we see here? Frontal bone, coronal suture's gotta be back there. Parietal bone, nasal bones. I can see my maxilla going up in there. I can see my superior orbital fissure, sure, yeah. I can see my temporal bones over there. I can see my zygomatic bone, maxilla, my teeth, dentition fitting up into the alveolar, or up into the alveoli. You can see the alveolar processes sticking down in there. What else can I see? Oh, in here, there's my middle and inferior nasal concha. 13 is my vomer. 8 is the perpendicular plate of my ethmoid bone. What else? So there's my sphenoid bone back there. Zygomatic, temporal, mandible. Okay, that's your skull. Here is your hyoid bone. It wasn't your hyoid bone, it was Kelly's. And this is Chantel's. Whoa, right there. Hyoid bone. Grand. Alright, vertebral column. You have your whole own vertebral column right here. Look up there. Oh, look, we've even got part of the occipital bone. So you can see the occipital condyles articulating with C1, the atlas. C2 is your axis. Okay, so what do we need to know about these things? Let's check it out. C1 has got no body and no spinous process, and there's no intervertebral disc between these two vertebrae. And that's because they have to like allow for a lateral and medial rotation of the head. Okay, so C2 has this thing, the odontoid process. For the dens. It looks like a tooth hanging out up there. Cool. Cervical vertebrae. Transverse foramina. Where are blood vessels? Oh, that serve the head are entering. So, pretty cool. What else do we need to know? Bifid spinous processes. Okay, C7 is your vertebra prominens. Right here. It doesn't have this bifid spinous process. It's the first one you really feel sticking out of the back of your neck. What else do we need to know? thoracic vertebrae. Okay, these are T1 through T12. They have these downward pointing spinous processes, and they've got these articulating facets for the ribs here on the transverse processes and on the body. So, hold on. If I were a rib, I would be in this drawer. Let me check it out. Oh, it's even perfect. It's the correct side. So how our ribs articulate is that they wrap around like that. So you can see articulating surfaces on the body of your thoracic vertebrae and on the transverse processes. Okay, see that? Great. What else do we have to see? Transverse costal facets, inferior and superior costal facets on the body. So the inferior costal facet is right there. The superior costal facet is right there. Okay, but we just saw that. Okay. What else? Yeah. Lumbar vertebrae. Spinous processes are short and hatchet shaped. They have these really big weight-bearing bodies. That's it. Sacrum, fused, coccyx, fused, thoracic cage, sternum, ribs, thoracic vertebrae. So for your thoracic cage, you have the manubrium, the body, and the xiphoid process, which make up the sternum. Manubrium, body, xiphoid process, sternum. Articulating with your ribs, your true ribs are all of those that directly attach to the sternum with costal cartilage, starting with true rib 1, ending with true rib 7. And then our false ribs are 8 through 12. 11 and 12 are floating because they don't have any costal cartilages. These ones do, but their costal cartilages are attached to another costal cartilage, which makes them false ribs. Okay, great. I 100% guarantee you, your professor will ask you some of these discussion questions from your lab to make sure that you're doing lab. So how about you make sure you answer those discussion questions? I'm not going to do it for you. I'm just the assistant with a bad attitude. Here we go. Axial skeleton, skull, vertebral column, thoracic cage. We've been through this before, people. There are your true ribs and your false ribs and your floating ribs. There's your vertebral column. There's your skull. That's your axial skeleton. Your appendicular skeleton, the girdles and the limbs. Okay, here we are back with Kelly. Here's Kelly's clavicle and scapula. On the clavicle, you don't need to know any markings, but on the scapula, you do. So, on the scapula, you have to be able to identify left versus right. So how you're going to do that is you're going to put this glenoid fossa laterally and the spine inferiorly. And know that that is the left scapula. Wunderbar. Glenoid fossa, glenoid cavity, great. Spine. This is your acromion. This is your coracoid process. This is your supraspinous fossa, infraspinous fossa, and subscapular fossa. What I love about those fossae is that they have muscles that are named like supraspinatus, infraspinatus, subscapularis. Those are all part of your rotator cuff, which we'll be talking about soon. And what's cool is that if you ever have your shoulder go on lockdown and you can't move, a really well-trained massage therapist will lift up your arm and she'll go in through your armpit and she'll massage subscapularis. possible. It's not. I digress, but I'm allowed. Call it a brain break and lab credit. Humorous. There's nothing humorous about this. There's your head. And your greater and lesser tubercle. And your shaft. And your medial epicondyle. Okay, weird. And your capitulum. Okay, and your trochlea. Cool. And your olecranon fossa. It's back there, I promise. Here, let's go find it in a drawer. Okay. What kind of humorous is this? It's not a funny one, it's just a bone. There's my head. There's my olecranon fossa. There's my trochlea. There's my capitulum. That means this is a right humorous. Why did I even come over here to show you that? The olecranon fossa all on its own. The lab assistant should have gloves on. Okay, next, radius and ulna. We got this. Radius. Oh, that's the head. That's the parietal tuberosity. It's a styloid process. Is that all you need to know? Oh, and the shaft, the big long part. Okay. Where's the ulna? Ulna's easy to tell because it's got that trochlear notch. Why? It's going to grab onto the trochlea. That is the olecranon process. That's the shaft. Styloid process. Anything else we need to know? No, those are my feet squeaking. Not farts. I'm not funny like your professor is. Okay. Hand. The hand is over here. Carpals. Metacarpals. Phalanges. Your digits have proximal, middle, and distal phalanges. Your pollex only has a proximal and distal phalanx. Yeah, that's it. Okay. Show us your arm, Kelly. This is the humerus. That's the head and the greater and lesser tubercle. The shaft. See down here, the capitulum articulates with the what of the what? The head of the radius. The trochlea articulates with what? Of the what? The trochlear notch of the ulna. Okay, see? And there's the trochlear notch holding on to the trochlea. Oh look, there's the olecranon process going into the olecranon fossa. It's amazing. Okay, shafts. Pointy things that look like styluses. Styloid processes. Ba-dang dang. How did I go from the hand back to the forearm? I don't know, because it's late. I don't get paid overtime. All right. Bones of the pelvic girdle and the lower limb. All this is an oscapsa with an ilium and an ischium and a pubis. Obturator. Iliac fossa, acetabulum. What else do we need to know? Iliac crest. Anterior superior iliac spine. Greater sciatic notch. Okay. Iliac fossa. Yeah, we already did that. Okay, ischiotuberosity. You're probably sitting on it right now. And that is okay. Okay, pubis. Great, right there. Other markings. Pubic symphysis. You can only see when you get two pubis bones together. That's the pubic symphysis. And other markings. That is the acetabulum. And look, all three bones come together. The ilium, the ischium, and the pubis all come together in the acetabulum. Sacroiliac joint, again, you cannot see unless you come in here. This is the sacrum. This is the ilium. That's the sacroiliac joint. It's a synovial joint. What else? Femur. A femur. Whoa! How are you gonna know left versus right? You're gonna take the head and you're gonna put it medially. Okay, medially this way or medially this way. Well, let's find this big old divot right there. That's gotta go posterior. So what am I? Oh, I'm a right femur. Okay, what else do I have to be able to identify? Neck. The femur is the only thing with trochanters. It's really cool when you're like a little one and you're developing and you're walking around and growing femurs. Your muscles pull on it as it's developing and pull these trochanters out. It's great. There's a greater one and there's a lesser one. And there's an intertrochanteric notch, but I don't think you have to know that. Shaft. And then you need to know your medial and lateral condyles. So the condyles are these nice articulating surfaces, and the medial one is going to be that one that's right below the head, and the lateral one is going to be that one that's not below the head. That's all you need to know. Patella. Ooh, do I have a single patella? I don't know if I do, but here's a patella. Okay. Tibia. Just let me see your tibia. Okay. So here, see, our tibia articulates with our femur, and so now we need to know our medial and lateral condyles. Tibial tuberosity, big bumpy part right there. It's the attachment point for your quadriceps femoris tendon and your patellar ligament. Shaft. Medial malleolus. If you have an I Heart Mom tattoo on the inside of your ankle, it's on your medial malleolus. Okay, great. Fibula. This is your fibula. You don't need to be able to identify left versus right, but that's your lateral malleolus, and you do have to be able to identify that. There's the head. There's the shaft. And if you've got an I Heart Mom tattoo on the outside of your ankle, it's right there. Maybe you've got an anchor. Maybe your mom's a pirate. Okay, tarsals. Down here the foot. Do we have a foot? Where's your foot? Kelly has a foot. Nice. Okay, tarsals right here. You have to be able to identify talus and calcaneus, but not as individual bones. They would be on a foot. So calcaneus is your heel. Rhymes with calcaneal, and that's your calcaneal region. And there's your talus, which takes the weight off of your tibia. Okay, so then all the rest of those little bones in there are tarsals. And those are metatarsals, and then those are phalanges. Your hallux has a proximal and a distal phalanx. All the rest of your digits have proximal, middle, and distal phalanges. Is that it? I really feel like that's it. Except for the knee joint. Kelly, why did your leg fall off? And why can't you hold it, okay? I just don't even want to have to deal with his leg anymore. I think I quit. Knee joint. The tendon of the quadriceps femoris is that bad boy right there, which is going to merge with the next thing on your list, the patellar ligament. Tendon of the quadriceps femoris, patellar ligament, both attached to the tibial tuberosity. Medial collateral or tibial collateral ligament is right there. You say, how can you tell that's medial, lady? Well, because in your leg, you've got a tibia and a fibula, and your tibia is medial. That bad boy is my tibia, which makes that my medial collateral ligament, or my tibial collateral ligament, which makes this my lateral collateral ligament, or my fibular collateral ligament. Okay. Anterior cruciate ligament is going to be deep to this bad boy. Hey, it's anterior. Ooh, it's limiting anterior and posterior movement, or movement in the sagittal plane. Ah, it's the anterior cruciate ligament. Oh, it's posterior, and it's limiting movement in the sagittal plane. It's the posterior cruciate ligament. And there's my medial meniscus and my lateral meniscus. And then I'm done with this lab. How can I tell it was medial lateral? Well, now again, the tibia is medial and the fibula is lateral. So I know that's my medial meniscus, my lateral meniscus. Both are made of fibrocartilage. And that brings us to the end of lab. I will see you for some muscles. And so will they.